I had my laparoscopic hysterectomy with a affirmectomy on the 12th of November, just before lunch. I was on an all-female ward. It was a specific gynecological hospital ward. I didn't find it as hard as I thought I might, just because the staff were really kind and supportive, welcoming. As soon as I got there, they expected me. They took me straight to my room, which was at the end of the ward, and it had a door and my own bathroom, so I was fairly separated from everyone else, and I didn't feel like I was being treated as a woman. This week started off with some bleeding that I kind of assumed was my stitches dissolving, but as it was only a week and a bit post-op, I thought it would be best to ask the ward if that was normal and what it was. I called them and I got a bit of conflicting information. One nurse said that it would take about 2 weeks for my internal stitches to dissolve, and when I called on the phone about the bleeding, the nurse said that it would take about 6 to 8 weeks to dissolve, so it was probably too early for it to be my stitches, but the bleeding was normal. It's been tough mentally as well as physically. I really underestimated my recovery time. I wanted to just do a little 6-week post-op update. It's been about 4 months since I've had my hysterectomy, I think. My scars don't bother me that much. I don't get any pain. I haven't had any more bleeding. I think the bleeding stopped after about 6 weeks, which was great. The biggest good change that I've noticed since my hysterectomy is my facial hair. I feel like that's coming in a lot more now, and where I had patches of peach fuzz before, I've got little bits of stubble, and I'm having to shave weekly just to kind of neaten things up. I'm a little bit over 6 months post hysterectomy, which has flown by, but I wanted to talk about how I'm feeling, how I'm doing, if I'm fully recovered, if my menopausal symptoms have slowed down. My name is Ocean, I'm trans-masc, and I had a hysterectomy 5 years ago. I had everything taken out: cervix, uterus, fallopian tubes, both ovaries. It's all gone. Do I regret my hysterectomy? Kind of. I'll explain more a bit later. I asked on Instagram what questions you had around my hysterectomy, and you delivered. I'm gonna try and get through as many as I can today. I think I've got about 20. So let's get into the questions. First question is, what made you decide to get a full hysterectomy? My thought process was, I have been on testosterone for over 5 years. I was under the impression that my reproductive system was going to decay and rot inside of my body if I didn't use it. Basically, the information that I was finding was it becomes dangerous when you keep your reproductive system and you're on testosterone. I knew I didn't want to have biological kids. I knew I didn't want to have a period again. So I just thought, get rid of everything. I don't need it. I also didn't want to have smear tests or a risk of cervical cancer, so I thought I'd get rid of that as well. So I'm empty. The second question is, how did I find a doctor? I can't remember the name of the surgeon who performed my surgery, but he was like the local person in the northeast who performed hysterectomies. I was referred to him by my gender clinic because I said I wanted a hysterectomy, and I had a meeting with him and he talked to me through the options. He was really nice. He didn't try to convince me not to have one or make me sign a waiver that my husband was okay with me not ever having kids. He was just like, it's your body, your choice, what do you want to do? So that was great. The next question is, did your doctor have a BMI limit? I don't remember fully. I know that there was a BMI limit for the lower surgery that I wanted, which was, I want to say like 30, maybe 32, I don't know. I don't fully remember the exact specifics, but I know I was bigger and I've always been bigger, so Hope that helps. Question 4 is, what was something unexpected you experienced after your hysterectomy? I don't know if anyone's heard of this, but proctalgia fugax. Am I saying that right? Basically, the muscle spasm in the pelvic area. And I think some people who have periods can experience this pain too, but it's basically just really sharp shooting pains that go up your butt. That was by far the most painful part of surgery, and that was experienced days after surgery whenever I would overdo my activity physically. The first time I experienced it, I was out shopping with my ex, and I got back in the car to sit down, and I like screamed out in pain because of how painful it was. The pain was like lasted seconds, but it was just really intense, and it came and went every couple of days. I thought I was dying. I didn't really know what was going on. I even had an exam, like a butt, finger up the butt exam from the like ward that I stayed at, and no one knew what it was, but then I just googled it and proctalgia fugax came up. I think Kegel exercises can help because it strengthens the muscles. So I would do that way in advance of surgery and while I'm recovering too. Question 5 is, how hard was recovery in comparison to top surgery? Similar, I think, for me anyways. I had it done laparoscopically, which means there's like 4 tiny incisions, and so there wasn't really anything I could see on the outside that made me think I need to take it easy. It was all just very internal. I kind of felt like my ovaries, or where they used to be, was like swelling, and they were like 2 golf balls trying to push their ways out of my stomach, if that makes sense. Olive, why have you picked now to have zoomies, please? I did find that any time I pushed myself, like going upstairs or walking around, I would bleed. So I kept like pads in my underwear for about 6 weeks. I was told that bleeding can happen between 2 to 6 weeks, and it's just the internal stitches from having my cervix removed kind of dissolving or just being irritated. So that was that. So recovery was fine. I was just bored, and it was a bit like uncomfortable, but it wasn't really painful apart from the butt spasms. Question 6 is, do you have visible scars? So I have 1 in my belly button, 2 either side, and 1 lower down. I can barely find them now, so I'm gonna say no, but they kind of look like chickenpox scars, which I have already, so sometimes I get my scars confused. Excuse me. So I was actually about to film some B-roll about my scars, but I actually couldn't find them, so there's no B-roll. I guess that answers the question of, do I have visible scars? I don't know, I can't find them. Like, I've looked everywhere. I just don't know. I have like stretch marks on my stomach, and I just can't tell what is a stretch mark and what is a scar, so but sorry, not sorry. Question 7 is, did the hysterectomy affect your ability to self-lubricate? Not that I have noticed, but I know that testosterone can make that difficult anyway, and I've experienced that on testosterone. Question 8 is, how did you know that you didn't want to carry a child? I have just always known that I didn't want to be pregnant. From like the age of 5, I was pretty set on adoption. I did have a period of sort of grieving what I couldn't have anymore after I had a hysterectomy. I was like, oh, maybe it would have been nice. But then I also was like, if I care that much, I can adopt. And now I'm at a point where I don't care that much to have children, so yeah. I'm sorry that's not a super helpful answer. Question 9 is, did it affect your sex life? Ow, Olive. No, I don't think so. You have to wait like 6 weeks anyway before you can do anything while your internal incisions heal, and also just because you've had surgery. But I wouldn't say I noticed anything different. Question 10 is, do you still get cramps? Which I guess links into the previous question about sex. In terms of period cramps or menstruation. I don't get any cramping like that, but I didn't really have that when I had everything I had before. However, I did used to get quite bad cramping after orgasms, and that is quite a common thing I've heard from other people too. I would say that I don't experience that anymore, or if I do, it's very rare. It's not as painful as it was before, and maybe it's just a little bit of a dull ache, but cramping is definitely not as painful as it was before, and I know that because I totally forgot that I had cramping until I was asked recently, so that's a good sign. Question 11 is, do you have a cervix and does penetrative sex feel different? I don't have a cervix anymore, and I would say it doesn't feel different than it did before. I know some people say that they have experienced a difference in sensation afterwards. I personally haven't. Question 12. Do you have any problems with your bladder? Yes, I have a very weak bladder now. If I sneeze, I will piss myself. That's just something that's happened since my hysterectomy. I'm sure if I did Kegel exercises, then that would help. But I forget, and I only remember to do them when that person on TikTok comes up and she's like, squeeze to the beat. So I would like her to come up on my For You page more often, then I will remember to do my Kegels. So yes, I do have more of a problem with my bladder. Who's in the weak bladder club? Question 13. Are you concerned about a prolapse? No. I was looking this up the other day because I had kind of forgotten that it was ever a concern. I am not concerned about a prolapse, and if it did happen, I would just deal with it as and when, or if. Touch wood. Question 14. Are there any differences in how you feel? Mentally, just not having to worry about periods coming back or getting pregnant has been nice. I'm sure there have been times where I have been at risk of being pregnant, so not having to worry about that has been a blessing. Question 15. Any long-term health issues? Not really, but I will go into that when I get to question 18 or 19. Question 16. Is it true that it can cause bone issues from changes in hormones? I'm not fully sure on this. I know that hormones have a lot of say when it comes to how your body functions and how your bones are affected. Just make sure you're talking to a doctor about your hormone levels and getting your blood tested and things like that. Question 17. What changed body-wise? I think it's hard to tell because I'm also on testosterone, so are the changes because I've been on testosterone for like 12 years, or are they because I've had a hysterectomy? Aside from like body hair and facial hair thickening, I don't think it's had that much of a change. Maybe my hips have like gone in slightly, but also that could just be testosterone doing its thing. I wouldn't rely on a hysterectomy to change how your body looks. Question 18 and 19 are you happy with your decision, and what are things you wish you knew going in? I'm going to merge them together because I have things to say. Am I happy with my decision? Partly. The only thing I regret is not keeping one ovary. This is for the sole reason that I have massively struggled with menopausal symptoms since my hysterectomy. Another reason I wish I kept an ovary was in the instance that I can't access testosterone. I'm fully reliant on the NHS or like synthetic hormones to keep my body like functioning. Otherwise I would have no or very little hormones in my body. Hormones do so much more than just like give you the effects from puberty. They like affect your mental health, they affect your function, they affect your like bones, everything about your body. And I think I was kind of led to believe that I wouldn't need them unless I wanted kids, and because I didn't want kids, I was just like, okay, well, what's the point in keeping them? I wish I kept at least one just so I had a backup of estrogen. If there was anything I wish I knew going into my hysterectomy, I wish I kept an ovary, because now I don't. And my menopausal symptoms have been like extreme hot flushes, night sweats. I was really embarrassed to go back to university when I recovered from surgery, because I would be sitting in a class in, I don't know, springtime when it's not very hot, and I would be dripping with sweat because of my hot flushes and just inability to like cope. I fought for so long to get support from my gender clinic, from the doctors I spoke to, but my GP would say, this is not my speciality, go back to your gender service. My gender service would say, if you still feel like this in 3 months, come back. And it's only been in the last couple of days when I told my gender therapist that I was losing faith in them, because I brought this up every time I had a meeting for the past 5 years and nothing got done. So I am super disappointed in the way that that has been dealt with, and I've lost a lot of faith in my gender clinic therapist or doctor. So everything has been fine apart from the menopausal symptoms, which would have been not as bad if I kept an ovary, I think. If you're interested in learning more about hysterectomies, I actually illustrated a guide for Folks Health, which I'll link in the description. It gives you loads of information about it and like images of how it works and what different surgeries are called, so definitely check that out. Also, thank you so much to my patrons who help me make videos like this. YouTube has demonetized my channel because I create queer content, and they will not let me monetize any channels that I make in the future. So if you would like to, please consider supporting me on Patreon so I can continue making videos like this. Patreon is essentially a club where you get perks from me if you pay a certain amount, and the membership starts at £1 a month and you can cancel at any time. So if you want to, then please do. I would really appreciate it. If you don't want to, that's totally fine. Just please consider supporting me in other ways, like commenting, sharing, sending this to someone that might find it useful. And yeah, thank you so much. Let me know if you have any other questions or anything you want me to answer, and I will speak to you soon. Thanks, bye!